Hello, my name is Jacqueline Plant, and for KERCA, I will be presenting a policy analysis of the Massachusetts Home and Community-Based Services waivers, which these are waivers serving the brain injury community. So before I jump into the waiver, I'm just going to do a little introduction about brain injuries. So severe brain injuries have become a hidden epidemic within our society, as an injury to the brain is not a curable short-term event, but the beginning of a lifelong disability. And for too long, nursing homes have been the default placement for older adults and individuals with disabilities such as a brain injury. And this restrictive environment is not appropriate for all brain injury survivors, which is why downstream approaches that move residents out of nursing homes and into community care settings are a more realistic and appropriate option. And an example of the downstream approach is the Home and Community-Based Services waiver. So before we jump into that, I just want to go over some general facts and statistics about brain injuries. So brain injuries, or someone in the U.S. sustains a brain injury every 9 seconds, and that's according to the Brain Injury Association of America. Also, according to the Brain Injury Association of America, more than 3.5 million people sustain an acquired brain injury each year, but the total number of incidences is unknown. And the reason that it's unknown is because some people may sustain a brain injury and not realize that they did. They may hit their head and just think, oh, I'm fine, I'm not going to go to the hospital, when in reality, they sustained a brain injury. I'm just going to go over some terms that I'm going to be using throughout the presentation, and that is an ABI, which is an acquired brain injury, and that is any injury to the brain that is not hereditary, congenital, degenerative, or induced by birth trauma. And a TBI is a traumatic brain injury, and that's a type of ABI caused by trauma to the brain from an external force. And this graphic to the right is from the Brain Injury Association of America, and it shows the leading causes of TBI, with the number one cause being falls. Then it goes into assaults, motor vehicle, traffic accidents, struck by something, and the unknown. So now that we have this data out of the way, when talking about any policy, it's important to go over the history. So the history of the HCBS waivers is that it was established by Section 2176 of the Omnibus Budget Reconciliation Act of 1981, and this was incorporated into the Social Security Act under Section 1915C, which pretty much means within broad federal guidelines, states can develop HCBS waivers to meet the needs of people who prefer to receive long-term care services and supports within their home or community setting as opposed to institutional settings. And this also allows states to waive certain Medicaid program requirements so the waiver can be used. Furthermore, in 2005, a National Money Follows the Person rebalancing demonstration program was rolled out. And this program meant that states receiving grant money were required to transition institutionalized people to a qualified residence in the community and continue to provide community services as long as needed while Medicaid eligibility is maintained. This has since been adapted across the U.S. and is now known as the Moving Forward Plan in Massachusetts, which I think is a more appropriate name than Money Follows the Person, and it also keeps the same acronym of MFP. And when talking about the history of brain injury, especially in Massachusetts, you can't not talk about the Hutchinson v. Patrick case. In 2008, a class action lawsuit charged the Commonwealth of Massachusetts for violating the ADA by failing to provide services to thousands of people with brain injuries in long-term care facilities across the state. And they won this lawsuit, and the state is now required over time to eliminate unnecessary institutionalization, create funding streams for the Medicaid waiver, and implement a lottery system for applicants starting with 100 spots and increasing yearly. This has since been amended in 2013, and the requirements from the amendment is that they must increase the number of spots over the next 6 years, they must implement outreach efforts to make individuals aware of services, expand covered services, allow plaintiffs to review policies and procedures, and the defendants will meet quarterly with plaintiffs to provide reports and data. This is a groundbreaking settlement for many reasons. Number one, this sets guidelines for other states on how they should be approaching and helping the brain injury community. Number two, this is the first settlement on behalf of persons with brain injuries in a class action case in the United States. And number three, this is the first case on behalf of persons with brain injuries under the Americans with Disabilities Act in the United States. So that's a pretty crazy that this all happened in Massachusetts. A pretty groundbreaking case and settlement. So now that we've gone over the history, let's talk about what are the HCBS waivers. So they're split up into two categories who they're overseen by. There's the Massachusetts Rehab Commission, or MRC, and the MRC oversees the ABI non-residential waiver and the Moving Forward Plan community living waiver. And then there's a Department of Developmental Services, which is DDS, and DDS oversees the ABI residential habilitation waiver and the Moving Forward Plan residential supports waiver. To go into the waivers a little bit more, I'm just going to talk about eligibility. So for the MFP, or Moving Forward Plan waivers, the applicants must be living in a long-term care facility for at least 90 days. They must be age 18 or older with a disability, or age 65 or older without a disability. They must meet all clinical requirements. They must demonstrate a need for the MFP waiver services. They must meet requirements to qualify and maintain the Mass Health Standard Plan. They must require a need for 24/7 support, and they must be able to be safely served in the community. For the ABI waivers, the applicants must be living in a long-term care facility for at least 90 days. Again, they must meet all clinical requirements. They must have experienced an acquired brain injury at age 22 or older. They also must meet financial requirements to qualify and maintain the Mass Health Standard Plan, be able to be safely served in the community, and demonstrate a need for the ABI waiver services. So with any policy and talking about it, it's important to talk about what the policy intends to impact and it intends to address. So the HCBS waivers, or the Massachusetts HCBS waivers, aims to address the social problem of lack of community supports in transitioning individuals with a brain injury to less restrictive environments. It aims to, or it intends to move individuals with brain injuries out of long-term care facilities and transition them into the community. And this can be done through living at home with supports or living in a group home with supports. It intends to provide a multitude of options of support for brain injury survivors and their families, which is a population that's often forgotten. And it also intends to impact the deinstitutionalization movement, which is just moving individuals out of long-term care facilities and into the community. Now that we've gone over what it intends to impact, we go into the unintended and the gaps. So some gaps that I have noticed throughout my research and through my internship of working with individuals with brain injuries is that there's a lack of diversity in the few research studies available. The few research studies that are available are mainly from white middle-class individuals who are already currently receiving brain injury services. So that leaves out a big population of people that goes unrepresented. And this causes like a lack of accurate data for decision making, which in then causes a lack of funding for the brain injury community. Another gap that has been noticed is that those who are not currently receiving professional services cannot apply for the majority of brain injury waivers, as they require residing in a long-term care facility for at least 90 days, which means that people who are living in the community and sustain a brain injury, if they don't need to be in a nursing home, or a long-term care facility, they would have to place themselves in one in order to apply for the waiver, which is kind of counterproductive because the waiver is promoting independence, not dependence. There's also a gap between the system level response serving brain injury survivors and their families is really inadequate. It's been noted through research studies is that there's just a lack of professionalism and a lack of knowledge regarding brain injuries and the brain injury community. Now that we've identified these gaps, it's important to talk about the strengths and the weaknesses of this policy. So the strengths is that this policy attempts to address the social problem of lack of adequate supports in transitioning individuals with brain injury to less restrictive environments, which that's a very unique social problem. So it's awesome that Massachusetts has a policy aiming to address this. It also attempts to address a vulnerable population such as the brain injury community that is often forgotten about. Some weaknesses noticed in the policy is that there's long periods of time spent waiting in the nursing homes during the application process. So the individuals applying already have to be in the nursing home for at least 90 days, and then they continue to be in the nursing home throughout the application process where they're either approved or denied. And sometimes the time spent waiting in the nursing home can cause their health to deteriorate and may result in them being a less desirable candidate at the end of it. Another weakness is that the mass health eligibility requirement can be counterproductive, meaning that I've known some individuals within my agency who have had to sell their assets, such as their home, in order to be mass health eligible to get the waiver, even to apply for it. And lastly, the public services are scattered and uncoordinated by people often can be deterred to apply because they're not sure, do I apply with DDS, do I apply with MRC? They're not sure which way to go, and the application can be confusing to find, so they just don't apply. So what can we do about this? The findings and recommendations from these gaps and through my policy analysis is that I recommend that there's a coordination of existing government programs to eliminate confusion among scattered services when applying. And this means to either have MRC or DDS, just one organization, oversee the services instead of it being through different avenues. I also recommend that there is an increased access to rehabilitation services following a brain injury, and this can be done through mandating insurance coverage in Massachusetts for cognitive rehabilitation and through identifying best practices for optimal lengths of stay for brain injury patients. Lastly, there needs to be increased awareness of alternative approaches. There's a program called Early Transitional Assistance, which is overseen by MRC, and this helps individuals who aren't necessarily ready for the waiver get ready for the waiver, and it just gives them an extra support. And there's also SHIP, the statewide head injury program, which is just another resource for the brain injury community. So now that we have these findings and recommendations, what can we do about it? How can we advocate and get involved? Well, first of all, you can get involved with organizations like the Brain Injury Association of Massachusetts, which, for those of you who don't know, the Brain Injury Association of America's first chapter was in Massachusetts. So Massachusetts has been on the forefront of brain injury policy for a while, and it's important for us to stay on the forefront to continue to adjust our policies and see how we can improve. And another way to advocate is by reaching out to local government, such as Governor Baker. You can send him emails, send him letters in the mail, try to call and lobby, and just let him know about what recommendations need to be done for this policy. And I thank you for listening to this issue, and here are my references.